Hello all, welcome to this very special episode on the occasion of World Hearing Day. Today we have with us a renowned ENT surgeon and cochlear implant specialist, Dr. Hetal Marfatia madam. She heads the ENT department at our very own KEM hospital. Welcome and thank you for joining us.
Thank you for the opportunity. The World Hearing Day is celebrated all over the world. It is put forward by WHO. It's mainly to spread awareness regarding hearing loss. This year's theme is changing mindsets and empower yourself. So all those who are suffering from hearing loss must come forward, get their hearing tested and take the relevant treatment for the same. The WHO wants each and every individual with hearing impairment to empower themselves so that they can be a part of society and they don't suffer from hearing loss.
So ma'am, my first question to you would be, what are the main causes of hearing loss and how it can be prevented?
Hearing loss can be congenital, it can follow the trauma, it can be due to infection, and it can be because of some tumors in the ears also. How we say congenital, traumatic, inflammatory, neoplastic, it holds true for hearing loss also. The congenital hearing loss should be addressed and identified early and intervene early to get a good hearing outcome, as well as to bring the child into normal stream, one must intervene early. Regarding the patients with infection, we should prevent the infection, and if there is infection we should treat it on time so that the ear infection is controlled and the hearing loss is prevented. You can do surgeries like tympanoplasty, mastectomy, and prevent the effect of infection on the ear. Regarding the congenital hearing loss, one can identify, and if there is no improvement with hearing aid, can offer cochlear implant. And there are also preventable hearing loss. In these days, because of the increased use of earphones, loud music, ear is affected. And this is totally preventable hearing loss, because noise induced trauma can affect the entire population. Even mere honking can cause hearing loss.
Yes, that is a very important point to note, especially in today's age. So, madam, my next question would be, how does hearing loss impact the mental health of a person and also the daily life activities of a person?
A person who is deaf has difficulty in hearing, so they strain their ears for hearing. They feel fatigue at the end of the day. They have a headache. Then they feel sometimes isolated because they cannot be a part of all the conversation. There is a lot of guesswork, and they have low self-esteem. They may feel isolated, and they may not agree, or they may not feel like socializing because they are missing out on conversation, and this itself can cause depression, headache, and isolation.
Yes, so I feel, madam, there is a need to kind of destigmatize this, and we have to take few steps extra from our side to accommodate them and not mock someone like we tend to mock, अरे इसको कम सुनाई देता है या बहरा है क्या अंदर. So we need to kind of.
So, what is the problem? That in the society there is so much sympathy regarding blindness.
Right.
If you have a patient with blindness, we'll say बिचारे को दिखता नहीं है.
Yes.
But अगर कोई सुनता नहीं तो बोला साला बहरा है.
Yeah,
So society has to change.
True.
Our approach towards the deafness has to change.
Yes.
Because if you realize now, it is more important sense than even vision. Because when we are sleeping, the eyes are closed and we don't use eyes. But when we are asleep, the ears are open, we hear, and it also helps in protection.
Right.
Because it is a loud sound, somebody entering the house, all that you can hear. So it is 24/7 spatial sense.
Right.
And what is good about it, that if it is lost due to some reason, we can regain the hearing by using bionic ear in the form of cochlear implant. So not only the patients who are born with deafness can be helped by cochlear implant, but also those who have lost hearing later in the life can also be helped by implants.
Ma'am, what are the most common misconceptions amongst the general public about hearing loss or deafness per se?
Basically, people accept wearing glasses, but they don't have acceptance towards wearing a hearing aid. They may use AirPods, they may use
Which
anything in
appears
the ear.
similar to that.
They look similar, but
And are fashionable as well.
and more fashionable, but they will not like to wear the hearing aid. So I always explain to the patients that I have difficulty having a vision, so I wear glasses. So if you have difficulty hearing, you should wear hearing aid. But the problem is that hearing aid is lot of commercialized,
True.
and there are a lot of companies and company representative who sell the hearing aid, and this hearing aid may not be tuned to patient's requirement and deafness. So basically every hearing aid should be brought or bought from the audiologist who has learned the science of hearing loss, and they can tune the hearing aid very nicely to the person's hearing loss.
Right.
And we are not buying the hearing aid for keeping it in the cupboard. So actually it should be usable by the patient, and it will be usable only if it is tuned properly, and there is a avoidance of the noise in that. Only then they'll be able to use it well.
Yes, that is a very important point, and all of the audience should also keep this in mind, that we need to normalize kind of wearing a hearing aid in those who require it, just like we are normalized glasses used in someone with having a visual acuity defect. Ma'am, regarding this particular hearing loss issue, what steps has KEM ENT department taken for the same?
KEM ENT department has been pioneer in micro-ear surgery. So our honoraries and our teachers spread micro-ear surgery throughout the country. So there is a very good basis of micro-ear surgery in KEM, and it was very easy for me to build up on cochlear implant in KEM hospital. Our all faculty members are well versed with cochlear implant, and they are offering these services to our patients. In addition, we are running a club for patients with microtia and anotia under the name of Hear for All, and this was launched in 2011, and now we have done over more than 50 patients surgery for microtia and anotia, for giving them the hearing, because I feel that their deformity can be corrected, but they must be empowered for hearing, and we give them a hearing in the form of Baha, which is bone anchored hearing aid, and also in the form of Ossia.
Yes, ma'am. It's very good to know that, as always, KEM is pioneering in such issues, and it really benefits the community a lot, especially someone from a lower socioeconomic background, the patients which tend to come to our institute. So it's a great work that you and your department is doing for them. So thank you for that, ma'am. So ma'am, the last question would be, what is your message for people who have difficulty in hearing or have some issues with their hearing?
Anybody who has difficulty in hearing or has issues with their hearing, they must come forward, get their hearing checked, and they should intervene. If there is a need for hearing aid, they must accept wearing the hearing aid, and if the hearing aids are not helpful, then even cochlear implant can be considered.
Thank you very much, madam, for giving such wonderful insights on the issue of hearing loss, especially on this World Hearing Day. And we hope to learn a lot more about this particular topic from you in the future as well. Thank you so much, ma'am.
Thank you for the opportunity. Thank you very much.